one all, and a very good morning from Nepal. Yeah, I'd like to extend this greetings as that it's relevant and appropriate across various time zones, as we have various viewers from Germany, the United Kingdom, India, and few from Nepal as well. So myself, Dr. Samya Maryal, and helping me today with today's webinar are my teammates from IMDF, which is an organization based in Kathmandu, Nepal. I'd like to begin by apologizing for my sabbiness because the pandemic and the ensuing lockdown seems to have taken a toll on my appearances. But shifting beyond appearances, I truly hope we can insinuate an intellectual discussion for better management of personal lives through this time of despair. One such resolve to end this despair would be through the better control of the stresses that occur in our day-to-day lives, and in keeping true to that motives. Today's webinar is on the theme of stress management and integrative mental health approach in pandemic from Nepal. It is our pleasure to broadcast this webinar on behalf of Integrative Medicine Development Foundation, IMDF. Now I'd like to welcome our respected speakers for today's webinar, Dr. Rishav Koirala, Dr. Binod Ghimire, and our guest speaker, Dr. Suhas Kumar Sethi. Now, with a brief introduction, we'll move on to the presentations. Dr. Rishav Koirala is working as a consultant psychiatrist for general psychiatry, Psycho-oncology and psychotraumatology clinic in Grande Hospital and Nepal Cancer Hospital and Research Center, Nepal. He is a PhD scholar at the prestigious University of Oslo. His PhD explores the biological and psychological components of mental trauma. He is one of the focal person for mental health for WHO Nepal in the past. He is also the executive director of Brain and Neuroscience Center, BANC Nepal. Dr. Binod Ghimire, MD, BMS. Dr. Binod Ghimire is a medical director at Arogya, Nepal at Kathmandu. He worked as a National Ayurveda Research and Training Center, Ministry of Health and Population, Government of Nepal as a yoga consultant. He has various feats to his name, the prime being he's the gold medalist in MD, Doctor of Medicine, Yoga and Rehabilitation from SVASA, India. Dr. Suhas Sethi, MD Ayurveda, PhD. Dr. Suhas Kumar Sethi is a professor and head of Department of Manovigyan Evam Manas Rog Ayurveda Psychiatry and Dean Research and Development at SDM College of Ayurveda and Hospital, Hassan, India. He has contributed more than 16 years in academic and research, along with research methodology and research statistics. Firstly, I would like to hand over the session to Dr. Rishav Koirala. His topic for the session is stress management of psychological impact of COVID-19. During the session, audience participation is encouraged. You can comment by raising your hands on the webinar platform. We will be discussing those comments during the discussion session. For Facebook enthusiasts, the live program is also easily accessible through IMDF Nepal page. We hope this webinar helps in questioning the norms, consolidating effective coping strategies, and broadening the intellectual horizon. Without further ado, Dr. Rishav Koirala.
Thank you. So, police of one just please just select your attendees. Please provide your pulley. Thank you for the first question. Second question, we are launching it. Thank you for your opinion. Our question we are trying to do. very much. Next question, please. Next, one more question. Thank you very much.
Hello everyone. Today I'll be talking in brief about stress management of psychological impact of COVID-19. Sorry, I'm having a bit of problem here. Okay. So stress, as we know, is a normal physiological response to any stressful event, and with the appearance of COVID-19 pandemic as well as the quarantine everyone is going through, along with the lockdown in some part of the world, we are having a lot of stress, and this stress has led to a lot of mental issues, psychological problems, and a lot of research has been done, a lot of articles have been written, and this one was published a few months back in Lancet. There was another article, research done in China just after they had their trouble with the pandemic, and it also showed that a lot of post-traumatic stress events were seen and stress disorders were seen in a lot of patients, especially in female gender. So today I'll be talking about a bit about factors leading to stress, what kind of symptoms can be presented, a person can present when they have stress related to COVID-19, and finally the management in short related to allopathic medicine. So I've grouped the factors leading to stress in three categories. The first one being fear of illness and impact. A lot of us are disturbed by not only the illness, but the fear towards the illness. For example, in Nepal, the illness has just started, the pandemic has just started, but people have been quite fearful since months. And this fear is at times unrealistic because of a lot of misinformation they get, and which are like provided by social media feeds and other unreliable sources. Even WHO has mentioned that people are not only dying of pandemic but also of infodemics. So we should be able to control all those like information, whatever comes to us, whether we should be able to select whether it's good or bad, and whether it's authentic or not. So along with that, people tend to over amplify their problems, and that also creates a lot of psychological stress. So another point that causes stress is change of environment. A lot with the quarantine and a lot of the lockdown that people are going through, a lot of problem has been faced. Like they are losing their coping mechanism, like going out for exercise, which was really good for mental health, or meeting people, ventilating, sharing, or getting involved in recreational activities helped a lot. Those One major problem with sleep-wake cycle, disruption of sleep-wake cycle, is there is a problem with circadian clock that we have. That circadian clock maintains the circadian rhythm, and we are able to function daily, like sleep at time, at a specific time, wake up at specific time, if the circadian clock is intact. But once it gets disrupted, it not only disrupts our behavior, like feeling hungry or feel sleepy, but also it creates other problems such as anxiety, insomnia, and other. It also reduces our immunity. So these are the main factors that leads to stress. Now, with this stress, people start showing symptoms. A bit of symptom related to stress is quite normal because it is a normal human response. But sometimes things get aggravated. People have a lot of sleeping problem, insomnia. People starting feeling lethargic. And there's increased emotional sensitivity leading to irritation, and sadness, worrying. People start worrying too much. Panic attacks at times might appear. People feel helpless, sad, and have difficulty to control, like do their routine chores. There are physical symptoms too, which are associated with COVID-19 symptoms, such as like feeling feverish, hot. Even patients come to me saying that they're suffering from fever, but then when they use a thermometer, the fever is not measured. The temperature is normal. So there might be feeling of nasal congestion, irritation in throat, coughing, headache, body aches, and pains. And along with that, other post-traumatic stress symptoms like worrying too much, repeatedly having thoughts of getting infected of COVID-19, and so on. The symptoms vary a bit in children because they have a different modality of presentation. They might show excessive, like irritation. They might cry a lot. They may show regressive behaviors such as bedwetting, thumb sucking, which they might have already passed through and left behind. There is excessive of worry and sadness, and other symptoms that I mentioned earlier, such as lack of concentration, body aches, and so on. Now, with all these symptoms, we should also be able to decide when to seek help and when not. First of all, it's always good to try to tackle all those problems, stress-related problems, by ourselves using good suggestions and few of the measures that I'm going to mention about. And if the symptoms are very overwhelming and people are not even able to do comply to these measures or follow these advices, then they should seek help. So maintaining daily routine is one of the most important thing, and I think it's very important throughout this period pandemic, where whether it goes out for months or even a year, we need to have a fixed time to sleep and wake up, separate a time for work. For example, there's plenty of work we can do from home. Like today, we are also partly working in one sense. So a lot of this kind of activities can be done. We should develop a habit of doing regular exercise, start meditation, which I'll mention a bit about meditation later. And I think yoga will also be mentioned by next presenter. So these are the things that helps us maintain daily routine. Apart from this, as I mentioned earlier, a lot of misinformation is playing a role in increasing our stress. So proper use of social media and screen time should be done. Even WHO has recommended to cut down screen time, like use less Facebook or WhatsApp and other social media. And we should try to see what the source of news is using authentic sources such as WHO's website, WebMD, or government sources gives us authentic sources. So we should rely on those. Another important point is connect and share. We should promote physical distancing, but not social distancing. We should try to communicate with people, be as social as possible, and even build up a habit of making phone calls or video calls daily with close one. We should at least tell ourselves that today I'll at least call 3 people whom I haven't talked for a while. So that really helps to share our worries, even share our queries about illness or other stuff, whether it's financial and other things that whomever we feel comfortable with. Another point is providing help and support in any way possible, if that's possible to be done, because that really makes us feel good, so it decreases our stress. I think this is a very important opportunity for us if we are with our family, to spend time with our family. I've talked with a lot of people, my patients and even close ones, and everyone has told that they haven't ever received such a long duration to be with their family. So we should try to make use of our time, spending time with children. If you have children at home, teach them how to do cooking, cleaning, and daily chores, so that getting involved with them, enjoying things, playing games and other stuff. Along with that, we rarely get time to spend time with our elderly, if they are at our home. So we should make a habit of spending some time daily, talking with them or engaging in common activities they can participate. Another modality could be making video calls to the elderly who are not with us. If they are able to communicate us with phone and other mediums, it would be nice to talk with them frequently. Now, I would like to mention few points which is relevant for parents, because a lot of issue arises when we have to deal with kids when they get really panicky or stressed out because of all this environment. Schools are closed and they're not able to go out, play with their friends. So they feel quite stressed up and restricted. So parents are the role model for the kids. So we ourselves should remain calm and assuring. Hiding information is another bad thing. So instead of overloading them with information, we should provide them honest, accurate, and appropriate information. Um, Showing videos of devastation, people's burial, and other very traumatic photos should be avoided. I think everyone should at least cut down screen time just to avoid those things too, because they are quite distressing. I'm going to mention a bit about mindfulness meditation, because this is one of the most popular modalities of stress relief used in psychiatry. Um, Mindfulness meditation comes from Vipassana. Mindfulness meditation. This one was taken from JAMA, Journal of American Medical Association, which shows the number of research done in each year. So it has been validated. So I would also like to recommend mindfulness meditation to all of the listeners, and request them to share the idea with other people. Um, there are a few points that I would like to share before I end my presentation. These are two links. One is a self-guided meditation, my mindfulness meditation. It's given by Michael Shelley, a psychologist. It's a good meditation technique. We can follow it in YouTube, and it's guided meditation. So it will guide everything, like whether it will guide you to close your eyes and do take each and every step. So it's quite helpful. Another mental health advice would be to go through this app, What's Up. This is the app that gives quite a lot of information about mental health. It's very easily accessible. It's free. You can download it in Google app or in iPhone. There are lots of strategies, coping mechanism that has been taught through this app, so it's really helpful. So I think, since these are hard times and we are not able to make use of things that we're doing in daily, like previously in daily activities, but still we can see it in a different way. We can take it as an opportunity where we have plenty of time to do several things that we thought we're not able to do, take some time with family and so on. So we can make it an opportunity rather than a loss. So with these words, I would like to end my presentation. I look forward to more questions and discussions. Thank you.
Thank you, Dr. Rishav, for that wonderful presentation. Now I'd like to hand over the session to Dr. Binod Ghimire. His topic, stress management, integrative mental health approach in pandemic. From the perspective of yoga is sure to act as a guiding light to provide much needed relief in these difficult times. Without further ado, Dr. Binod, please proceed.
Thank you, Dr. Samyam. Very much welcome to all of you. Hari Om. Today I'm going to discuss about the yogic management of stress during this pandemic period. As the previous presenter explained about the conditions of mental health during this pandemic condition, as we know, World Health Organization has declared COVID-19 as a pandemic, and lots of issues are there, psychological issues. So new issues are there in novice population, and the previously diagnosed mental disorders are being exaggerated due to this pandemic condition. We have lots of physical, mental, social, economical, and intellectual impact in this condition. So I'll discuss about the phenomenon, how this stress response is there, what are the different mechanism of coping strategies in yoga, what are the classical concept of yoga and research, and some important practice management of stress according to yogic lifestyle. So let me first introduce about the perception of stress. So before explaining all these things, I just want to imagine one imaginary condition. So let us suppose we are in the jungle and we are staying in the resort. Uh, Imagine that one of the staff from the resort is coming towards us and is telling that the tiger is coming. So what will happen in that condition? I will be fighting with the uh, tiger, or we will be flighting from the dangerous situation, as we perceive this situation as a dangerous situation. So this is called the stress response. During this condition, our sympathetic nervous system will be activated so that there will be fight and flight response, and our energy will be high, our respiration will be more, our heartbeat will be more. So this type of response is called stress response. And imagine another condition where the reality is not there, like the tiger is not there, it's only the rumor. What will happen? So we'll not be in the stressful condition, will not be in the fight and flight response, so we'll be in the relaxation response as we enjoying the our treat. Okay, so in this condition we have no more heartbeat, no more respiration, so we'll be in engine mode. This is called relaxation response. So such a both response are very much important before we understand the coping strategies using yogic ways. Okay, so this stress response, stress physiology is usually it's very new concept in modern science. It was really initiated by Hans Selye. He was the pioneer in stress physiology. And the relaxation response is also very new concept in modern medicine. So Dr. Herbert Benson is the pioneer in transcendental meditation research. He started doing lots of meditation research regarding this response, and he termed this relaxation response. And in relaxation response, usually we have more parasympathetic nervous system dominance. So there will be very less amount of respiration, no higher amount of heartbeat. In this condition, our mind will be very in peaceful condition, and our homeostasis is there. So both the responses are very much essential for our life also. This stress response is usually the survival mechanism, which is coming from our stone age. Like we are used to go to the forest, we have lots of danger situation. So this is a survival mechanism, but we are using such type of survival mechanism in everyday life, and we perceive the simple situation as a very much dangerous condition. So that same response is creating. So this type of response is called stress response, and lots of diseases are connected with stress response, high stress response. So this higher stress response usually creates high amount of cortisol. So cortisol is a stress hormone. So because of this, lots of issues are there. Even if we have good amount of uh, mind control, these things will return to turn into the physical level also. If we are very weak in our mental status, then mental symptoms will be clearly visible. Okay, so next I will explain the concept of disease in yoga. This is the basic concept from Yoga Vasishtha. Yoga Vasishtha is a very important textbook in yoga therapy. So in this text, there is a clear explanation of disease, that is Vyadi. So there are basically two types of diseases. One is from outward source, external environment, from toxins, from infection, from injuries. So this is called Anadi's Vyadi. And another is from stress. This is called Adis Vyadi. Even Adis Vyadis are two types. One is Sara, another is Samanya. Sara is essential disease. So because of our mental affliction, because of our mental irritation, mental modifications, we are not in the state of our real state, that is Sachidananda, always in the peaceful and blissful state. So this is also called disease according to yoga concept. And another type is Samanya Adis Vyadi. So these are the disease originated from the agitation of mind. So mind is agitated so that we can get a disease in the body level. So these are also called psychosomatic conditions. So lots of impact is there if we have agitated mind. So stress is one of the important factor for lots of psychosomatic disorders, including hypertension, diabetes, irritable bowel syndrome, in physical level, as well as lots of psychological disorders like anxiety, depression, insomnia, substance abuse. So root cause is stress in many cases. So we have to understand the concept of disease according to Yoga Vasishtha. So another important concept is how these agitation in mind really comes to the body so that they can create the symptom. This is also very much important idea from yogic literature. So according to yogic literature, we are made up of by lots of layers. These are called panchakosha, 5 layers. These are the 5 existence of our body. So among them, mental layer and intellectual layer are very much subtle layer. So if there is agitation in that state of our existence, if there is a prolonged irritation in that conditions, so that can actually lead to the imbalance stage in the prana. There will be disturbance in the flow of prana. So that is disturbance in flow of prana can usually deteriorates the level of Agni. So there will be the state of either Ajidatam, either Atijidatam or Kujidatam. So digestive Agnis will be very much affected because of the imbalance in our pranic level. And ultimately that leads to the disease in the level of our physical existence. So lots of psychosomatic conditions are due to the mental agitation. This is the basic concept from yogic literature. So this process is called prasava, that is manifestation of disease. So this can be really correlated with the modern physiology also. So before explaining this with the modern science, I will just want to explain some of the concept from Ayurveda also. Ayurveda regards the mental agitation and due to the pragya parada and asatma indriyartha samyog. So pragya parada is a defect in notational level, and asatma indriyartha samyog is a misuse of our sense organ. If these conditions are there in our intellectual and mental level, then that can lead to the disease according to Ayurveda also. So this is the concept from Ayurveda. So if there is a irritation in our mind, that can really lead to the disease. That is the basic concept. Okay. So another aspect from modern science is, if there is a stage of fight and flight response or stress response, there is a emotional center in our brain that is called limbic cortex. Among that, amygdala is one of the important part, which is called fear center also. If there is more irritation, more activation in emotional center of brain, that can really affects our hypothalamus. So that can really stimulates our the hypothalamus. Then hypothalamus can increase the level of CRH, corticotropin releasing hormone. That corticotropin releasing hormone again stimulates the pituitary gland, and this pituitary gland stimulates the adrenal gland by increasing the amount of ACTH, that is adrenocorticotropic hormone. And at the level of adrenal gland, there will be high amount of cortisol and epinephrine and norepinephrine. These are the important part of the stress hormones. Okay, if these hormones are high in our blood level, then there will be the chronic inflammation stage. So there will be the high amount of inflammatory markers like interleukin 1, interleukin 6, TNF alpha, CRP. So these can lead to the chronic inflammation. So nowadays, chronic inflammation is the root cause of number of non-communicable disease. That's why we have to understand the basic understanding from the modern perspective also. And in yoga also, there are various instances where we can get a direct impact. So in Bhagavad Gita, there is important sloka. So that is also very much relevant in this condition. So in this sloka, so sloka states that dhyato vishayan pumsha sangas tesu pajayate sangat sanjayate kama kamat krodho vijayate krodhat bhavati sammoha sammohat smriti vibramsa smriti bramsat buddhinasa buddhinasat pranasyati. The meaning of this sloka is, first we are attached to the objects, sense objects, then there will be strong liking of that attachment, and that will lead to the moha, kama, and ultimately our buddhi will be, our intellect will be impaired, so that we'll have a loss of destruction in our existence. So this is the basic concept from the Bhagavad Gita also. And there are lots of technique in yoga so that we can manage the stress. The basic concept of stress management is the coping strategies. According to yoga, so there are lots of techniques. So the disease which is manifested from the mental level to physical level is called prasava, and the reversal of that condition is called prativarsava. According to yoga, stress is termed as a bega. Bega is nothing, that is uncontrolled excessive speed of our mind. Mind is nothing but a collection of thought. If there are lots of thoughts in our mind, suppose, oh, this situation is creating lots of stress on me, so how to fight with this, how to fight from it, such type of feeling, such type of thoughts in our mind is really causing the disease according to yoga. So the whole process of stress management in yoga is prati prasava. And according to yoga, there are three types of qualities. These are called triguna. So sattva, raja, and tama. Sattva is a very much enlightened stage. Rajasic is a very much irritated stage, and tamasic stage is the dull stage of our mind. So we all are having all these type of qualities. If there is a high amount of tamasha, that is, we'll be feeling low mood, depressive thought like things, we'll not able to work in proper activities. So such type of mental condition is one of the important cause for the diseases. Another important cause is irritation in my mind. If too much agitation is there in our mind, that will also lead to the number of disease, as we already explained. So the basic stress management techniques from yoga is, we have to move from the stage of tamasic stage to rajasic stage, from rajasic stage to sattvic stage, and beyond that, that is called gunatit stage. So according to Sankhya philosophy, so we are made up of by three principles like sattva, raja, and tama. So this is the stage of the combination of this type of things is called prakriti. So we have to go beyond the prakriti and we feel our consciousness as it is. This is the whole principle of Sankhya and yoga. So in stress management also, we have to reduce our speed by balancing our both the system like sympathetic and parasympathetic nervous system by lots of very practices. So we can balance our Ida and Pingala Nadi so that we can uplift our energy up to the maximum level. This is the important concept. So another important thing is thing in stress management by using yoga can be explained through this bucket type of model. So this is called bucket model also. Here also we can explain the yogic concept also. So another condition, let us imagine that we have a bucket in our room. In this bucket, there are lots of pipes. These are pouring the water into the bucket. And there is a bottom tap from which the unwanted water is going to the drainage system. So the thing is, if we use this bucket for some period of time and we're not opening the bottom one tap, so what will happen? So the water will flow out and there will be the difficulties in our room. So this can be explained through the stress model also. So that arrows given above are the pipes, as I already explained. These are the stressors. So stressors are coming our life. We can't avoid the stressor. So some people say we have to avoid the stressor if you want to manage the stress. So in most of the cases, it's very difficult to avoid the stressors. So apart from fighting against the stressor, we can cope up with these things. So in this approach also, so the size of tank really represents the our vulnerability, like what type of body we have, what type of personality we have, what type of past experience of stress management we have, what type of health condition we have. So the level of stress, the level of water here, depends on our conditions, our body. If it is too weak, if we are more healthy, so that the water will not come easily. In general, in most of the cases, what we'll do is we usually close the tap by adopting the maladaptive behavior, like we use alcohol, we use smoking, these type of things we use as a part of pressure release. But we don't let them to go by opening the bottom tap, so that we'll be the ultimate sufferer. So yogic way of life is apart from fighting the stressor, we can open the lower tap so that the water, whatever comes to the bucket, it can go easily without affecting our body. So this type of coping strategy is very important. So this is called let go principle. And let go is very, very important so that we can have a coping mechanism. Okay. So another important thing is we can see from the yogic perspective also, according to yoga, the afflictions of mind, the irritations of mind are due to the klesa. Klesas are afflictions. There are 5 klesas according to yogic principle. These are avidya, asmita, raga, dvesa, and avinivesha. Avidya is a lack of proper knowledge. Asmita is ego, and raga is attachment, dvesa is aversion, and asmita is a fear of death. These type of things are also responsible for closing the bottom tap so that the water will flow out, so it can affect our conditions. So instead of closing this tap with the pancha klesha, we can have a lots of meditation practices, lots of spiritual practices, so that we can open the bottom tap, so water will easily go out, so we'll be in the condition of let go. So this is the approach of yogic management of stress. So instead of fighting against the stress, we can develop our coping strategy. This is the most important feature as we develop in the stress management through yoga. So there are now let me explain about the yoga research in stress management. So as the previous speaker already told us, there are lots of research on mindfulness meditation, with respect to stress management. And I will explain you about the very few understanding, very few research applications which are very much useful in this pandemic period, as well as the management of NCDs also. So let me explain some of the very crucial research studies in terms of stress management by using yoga. So one of the important concepts is use of yoga in epigenetics. So I think all of you know about the epigenetics. Epigenetics is above the epi is above, genetics is study of genes. This is above the gene. This means we generally say our genes are fate of our life. Usually we say our parents are depressed, so that I will be depressed. Our parents are diabetic, so I'll be diabetic. So some type of probability is there because of genes, but we can either switch on or switch off our gene by using our lifestyle approaches and yoga-based lifestyle. So there are basic methods, basic mechanism. So usually there are two mechanisms which are responsible for epigenetics by stress management. This is first one is histone modification. As we know, histone is a outer lapping of DNA. So if you do a very less stressful lifestyle, then the histone modification will be there. And another mechanism is DNA methylation. So by these mechanism also, we can change or we can postpone our tendency of disease. So this is also important concept. So another important research area from the stress management through yoga is antioxidant effect. So lots of studies showed yoga have antioxidant effect. So reactive oxygen species are called oxidant. So these are very much destructive in our health. So they can lead to the oxidative stress and lots of complications in non-communicable disease. And we can avoid such type of oxidant by increasing the level of antioxidant when we use stress management by yoga. So there are countless studies which showed if you do yoga, we can enhance the level of antioxidant level like glutathione transferase, catalase, and dismutase also. So these are also important application of stress management. Another important thing is immunomodulation. So lots of studies show if you do stress management, if you are in less stress condition, then our immune system will be very much effective. Natural killer cell can be enhanced, and as well as the cytotoxic T cells number can be enhanced. This is called immunomodulation or immune enhancement. So this can be happen by psycho-neuroimmunology. This is most important concept nowadays. So if we are in the state of very cool and calm mind, this can affect our nervous system, and by the nervous system we can
Dr. Binod, Dr. Binod, can you shorten your presentation because we are running out of the time?
So we can enhance our immune system by yoga researches also. So another important part is self-regulation. We can enhance our mental activities. Apart from that, neuroplasticity is another important concept. So in neuroplasticity, we can increase our BDNF amount so that neuron wired together and neuron fired together can be enhanced in this way. So another important is restful alertness. We can have a alert stage, but we are in the stage of restful condition. Another important aspect is happiness. Almost we can enhance the quality of life during this pandemic period by using stress management techniques. So another important part is yoga practices. What are the important yoga practices? So we can use sattvic diet. Sattvic diet is very much vegetarian diet, which is very much important because it can have a anti-inflammatory effect. Apart from that, we can use breathing exercise and pranayama also. So these techniques can really enhance the lungs function, pulmonary function. So we can have a lots of impact in our life. Similarly, we can use emotion culture. Emotion culture is bhakti. So bhakti can enhance our activities of left brain so that we'll be very cool and calm so that we can decrease the overactivation in limbic cortex. Another part we can use is asana. Lots of asanas are there. This can be used in various ways. Another important part is sat karmas. So there are 6 sort of purificatory process. We can use these also. So these are also very good practices to have a detoxification and stress relief. And meditation, as we already explained, lots of meditation techniques are there we can use according to our condition. And notational corrections, we can use lots of psychological counseling and mindfulness-based cognitive therapies in these conditions, and yogic counseling. These are also very important part. So another important thing is an integrative approach. So we can use all these practices with the help of all the treatment modalities. So if the condition is acute, we can use pharmacotherapy, and we can use a allopathy system of medicine. But in chronic condition, we can use Ayurveda and yoga part. So these are very important for stress management. And nowadays we are using such an integrative approach in Nepal also, with the help of Ministry of Social Development Province 5. So we are getting lots of good result. And this is the most important part. So we have to integrate all the modalities so we can enhance the effect of mental activities. We can reduce the stress conditions and mental disorders. Thank you.
Yeah. So very good morning to all of you. Welcome to the Global Ayurveda webinar being organized by Nepal, session 2, hosted by Integrative Medicine Development Foundation, Nepal. And I thank the organizers for this opportunity. And as we already had 2 speakers elaborating on the conventional medicine as well as the yoga perspective of the stress management, Dr. Rishav have beautifully explained about the common factors leading to the stress in this COVID pandemic, and also the common signs and symptoms, and a few very important tips that can be utilized for the management of the stress management. And he beautifully concluded with saying that we need to make it an opportunity rather than a loss. And regarding Dr. Binod Ghimire, he has given an yogic perspective about the stress management, and classified the basic disease into Adi and Anadi, which talks about the external and the internal factors of the stress problems. And very importantly, talked about the basic causes being the attachment of the basic diseases. And he has given various explanation for the basic aspect of the stress management. See, basically, the stress or health is what we perceive rather than what exactly we have. So it is more of a perception rather than a problem. So more than the stress, I feel that it is our response toward the stress which has to be considered in any diseases, maybe physical or mental disorders, and very so in case of the stress management, because the stress may not be the culprit. It is the body's response toward the stress, body's ability to respond to this can be different for different people, and so it can be in case of this pandemic. The stress for a general population is something different because he is having a lot of fear, anxiety, uncertainty, curiosity, etc. For a person with health professionals is very worried about his own life, do not have time for his personal care, and is worried about the safety. And especially the children and the elderly have their own risk group to be considered. And those people who are diagnosed with COVID have their own problem, because there will be a lot of fear, anxiety, and above all probably with a lot of social stigma around us. So that's the reason why these different people need to be addressed differently in cases of this stress. See, we're talking about the integrative medicine today. So as you all know how to integrate, it's a sense of healing where we use different aspects and we consider the individual as a whole. And it's a basic therapeutic relationship between the patient and the practitioner. And we try to incorporate all the possible therapies and measures which can be used for the management. And there are some quite important principles which need to be considered when I want to integrate conventional medicines, Ayurveda and yoga, because it is the patient centric, because he is a partner in healing, and we need to consider all the factors which are responsible for health, wellness and disease. So we take the body, mind, spirit, community. So all the conventional and alternative therapies which could be helpful for innate healing response, and which is the most appropriate, natural and less invasive option that has to be given to the patient. And at the same time, it is not just mixing any XYZ therapies. It is also research driven, inquiry driven with sufficient evidences. And not only on the disease, sufficient focus is on prevention and promotion. So how can we do this approach, and how can we draw this roadmap towards the stress management in this pandemic, and how we can integrate Ayurveda, yoga, and conventional medicine? So we basically divide them into three basic components. Screening, where I try to screen the patient's problems or the individuals, different individuals, assess them thoroughly, and probably plan the different parts of intervention. So this is a small roadmap that I've done exclusive for this session today. So we can always think of integrating the system and the areas. So system I divided into Ayurveda, conventional, and yoga, and areas as screening, assessment, and intervention. So we can have a detail, especially in area of Ayurveda, a detailed history of patient, and assess them based on their physical constituents, prakriti, their doshas, the digestive fire, and the mental abilities. And we can think of different options available, like the diet, lifestyle, various herbs, therapies, etc. In conventionals, various screening tools can be adopted, special standard scales, basic laboratory investigations, some scannings, etc. can be done to evaluate the conditions, and we can plan for different psychopharmacotherapies and the psychotherapies. In yoga, patient's fitness or ability to be fit for yoga and other therapies need to be understood, whether he is eligible for that, and whether you would like to go alone as a yoga therapy or would like to have the add-on with other therapies need to be understood. And different types of specific yogasanas, pranayama, dhyana, acupuncture, based on the severity of the stress can be planned. So this is how we can integrate this system accordingly. But to make this change, there are three basic ingredients which is required as an individual. The sense of awareness, need to be self-motivated, and most importantly, the emotional intelligence. How you're responding to the changes. What is your emotional response to the difficulties of life need to be understood. So briefly about what Ayurveda says about this stress management. The treatment can be divided into the diet, the activities and the lifestyles, the psychological measures, and the various herbs and therapies. So you need to understand the different factors, because Ayurveda talks very importantly about a very personalized approach. We cannot have the generalized approach for every individual. So based on the physical and mental constituents, based on their mental strength, based on their digestive fire, based on their essence of the tissues, one need to plan the different modalities of treatment. Like most importantly is the food. Like there are different food which has been highlighted, and different diets which has been highlighted as stress busters. Most important, like water, which can rehydrate the tissues and provide sufficient energy to the body. Milk, rich in proteins and antioxidants, able to fight against the wear and tear of the body. Ghee, rich in omega-3 fatty acids, and also has the ability to cross the blood-brain barrier and cause, it could be very, very important to improve the cognition, memory, intellectual capacity of an individual. Gooseberry, a potent immunomodulator and antioxidant, and various nutrients like raisins, almonds, walnuts are said to be very, very important in managing your stress. Ayurveda especially emphasizes on a vegetable called as ash gourd, which is very frequently available in India and Asian countries, which can be used in the form of the whole of the ash gourd can be cut into 8 pieces, and the pulp of this ash gourd along with the seeds can be mixed well in the mixer, and the juice of it can be consumed 50 ml twice a day with honey or sugar candy for 45 days, because this is said to be a very potent antidepressant and a potent immunomodulator along with the seeds. You need to filter it and take this juice 50 ml twice a day with honey. See, regarding the psychological processes or the activities, lifestyle, there's a beautiful quote which says that Satat Adhyanam Vadaha Paratantra Avalokanam Tadvidya Sevacha Buddhi Medakaroganaha. So regular reading from the reliable sources, because as speakers were telling about being away from this problem, intense discussion, try to go into the depth of this problem, and this is what the integrated and collaborative medicine, and various forms of seminars, webinars where discussion can be brought about. Most importantly is managing their psychological issues. Like there is a separate treatment modalities called as Sattvaja Chikitsa in Ayurveda, which refers to various mechanism or balance between both. See, we have both external stresses as well as the internal emotional stresses. Balancing of this is very, very important. And there are various therapies like the body massage called as Abhyanga, or applying the oil over the head, and the various types of Shirodhara or Tailadhara, and especially the medicated enema, because the stress is said to be disturbed Vata, and the best therapy for Vata is a medicated enema. Like either you can use the medicated ghee or oil, or the medicated decoction can be used under the expert supervision. See, there are various types of herbs which are said to be very, very beneficial in managing the stress, both in preventive, promotive, as well as in curative aspect, like Ocimum sanctum, Methania somnifera, Bacopa monori, Tinasfera cardifolia, Centella asiatica, to name a few of these herbs, which are very, very effective in being a potent anti-stress herbs. Even like turmeric, gooseberry are very, very beneficial. I would like to conclude with this model, which I would like to express in front of you, especially for the pandemic. Like it is called as ABCD 4321, where A stands for away from distraction and media, unnecessary social medias. Always rely on the authentic resources. B, be positive that it is a crisis, it's a critical period. We will definitely be able to overcome this, and probably it is a chance for us to refocus and readjust our priorities. So at the same time, C stands for being relaxed, calm, and most importantly, we need to start the refocusing of our life. And a little bit of daily exercise. Though we may not be able to go outside in some cases because of lockdown, we should always think that lockdown is not breakdown. Lockdown do not mean slow down. 4 liters of water. I mean to say sufficient amount of water. 3 times timely balanced food. 2 times of yoga and meditation, and at least have one recreational activities which is going to keep you activated. All these activities which you thought you would have been doing, like singing, dancing, drawing, or any activities which will keep you happy and engaged. So to conclude, I'd like to say that regular intake of balanced diet and activities, being analytical, being detached, being kind and helpful, having the mental equanimity, being truthful, forgiveness, respecting fellow elders and teachers will make a person healthy and happy. And I'd like to just say that we need to raise above this virus to fight against this virus. We rise to fight against the virus. So thank you, and I welcome various questions for the today's discussion. Thank you.
Thank you, sir, for that insightful presentation. Now we'll proceed on to the questions that were asked from all the attendees yesterday during the registration. First, I would like to begin with Dr. Rishav. And the first question is, mobile phones are essentially omnipotent. So, however, I feel like they help to facilitate much of the panic associated with COVID-19 situation. As you said, there's more of an infodemic than the pandemic. How can we refrain from getting panicked about the current situation? And beyond that, like, how do you think the effect of the current pandemic on the overall global or regional mental health would be in the nearest future?
Okay, I'll take it in breaks. First of all, I think everything has its own good and bad aspect. We can start with a very extreme example like atom bomb. We can use the energy to run our daily life, improve our daily life. We can use the same bomb to destroy our daily life. So it's the same with mobile phones. So how we use it is also quite important. So we should be quite careful about it. So as every one of us is quite, as I mentioned earlier too, like we know where the resources should be looked for. I strongly advocate using WHO or government news sources. Some of them might have like been a bit tampered also. At times people are quite suspicious about it, but still those are the best sources rather than going through YouTube or short memes in WhatsApp and Facebook. Those are the main sources. What was the second question, please?
The second question is, like, what do you think would be the effect of current pandemic on overall global or regional mental health? Like, reason being,
it's a huge thing. It's not only it's not only my opinion, but I'm quoting WHO, I'm quoting Nature journal, I'm quoting several other journals, economic forums. They say the first pandemic is of COVID-19, the second pandemic is of economic crisis, and the third is of mental health crisis. It will be quite lasting. The mental health crisis pandemic will continue till the economic crisis goes down. So it will take years for people to recover. But the thing is, like, if you take precaution from right now, then the amount of casualty or amount of damage that will be done, there will be some amount of damage, that's for sure, and has already been started. But that can be controlled or at least reduced to some extent. So we should be prepared for it. And as all of the speakers have mentioned, the advice given over here and good advice are the main sources which need to be followed to avoid those bad moments.
My next question is for Dr. Suhas, who pointed out and enlisted lots of modalities that can be applied on day-to-day life, such that it can lead to better control of stress. How do you view some better home-based remedies that can help cope up with stress? And also, can you please enlighten some specific measures prevalent in yoga and Ayurvedic world, such that they can apply on a daily basis, even at the time of the lockdown?
Yeah, I think I basically said that, especially in case of mild to moderate conditions where you're able to manage yourself. So it's very important to understand, but everything cannot be managed at a level of the home remedies or the simple prevention. Prevention can be done in majority of the cases, but one need to understand what amount or what is the quantum of the severity of the condition. If it is mild to moderate, or if you are looking for prevention as modalities of treatment in the stress management, I told you in terms of the food habits, definitely those which are locally available, easy to digest, and which are rich in vitamin C, antioxidants like gooseberries, citrus fruits, a lot of walnuts, and I told you the example of ash gods. They are said to be very potent anti-stress modalities. Especially next comes is exercise, sufficient exercise, because the movements and the postures helps a person to have a good cognitive ability, will be able to have a good control of his sense organs, and most importantly, it will keep a person's mood elevated, and there'll be a lot of sense of well-being. So a little bit of at least 20 minutes of exercise for 5 days a week is must. And along with that, there are some simple home remedies which can be done, like regular use of milk products, especially the ghee preparation is very, very useful in managing the stress. And there are some simple therapies, like you can massage over your foot, palm, and your head. And you can also apply the coconut oil, 2 drops to your nasal orifices, and just apply 2 drops of coconut oil once or twice a day in empty stomach. And especially the yogic practices, especially there are at least one can go for Surya Namaskara at least 5 to 10 times in a day based on your capacity and your age. And the pranayamas, like basic pranayamas like Nadi Shuddhi Pranayama, Brahmari Pranayama, and based on your constitution, if you're hot constitution or pitta constitution, you can definitely think of Shitali, Shitkari pranayamas. So definitely it is based on the severity, based on the individual, and especially if you can take the help of an expert and the physician, you can always get advices. And if you follow this on a regular basis, See, the most important problem is with the perseverance. You get some advices, you start for a few days, but you don't constantly do this for as a practice. See, all should see, that is what even Bhagavad Gita says, Abhyasa and Vairagya are the two modalities for the mental control. So all these advices and practices should go like on a regular basis. Okay, so this is what I'd like to say. Thank you.
Thank you, sir. Now my next question is to Dr. Binod. Dr. Binod, can you please enumerate some coping strategies that give instantaneous results? Like if anybody is suffering in stresses, like high stresses during this time of lockdown or pandemic. Hello, Dr. Binod.
Hello.
Yeah.
We can lots of practices from yogic perspective. So some long deep breathing exercise are very useful. During the stage of this stressful condition, we can close our eyes and take a long deep breathing within 5 minutes. We can have a very good relaxation response. Apart from that, lots of pranayama techniques like Anulom Vilom, Brahmari, this type of very good practices. So apart from that, yoga nidra in and abdominal breathing can be done. So we can lie down on the mats and we can inhale and bulge our belly like a balloon and exhale and sink down. This is a diaphragmatic breathing, and we can reduce stress within 5 minutes. This is also important part. So apart from that, we can have a very good amount of guided imagery techniques. Like we can imagine the natural scene so that we can have a healing impact. Like we can imagine the blue sky, the forest, or whatever river or mountain, and we can imagine the presence of these things, and we'll be there so that we can have a very nice impact. So relaxation response again we can create. And apart from that, as the previous speaker already told, so Surya Namaskar is one of the important part. We can do minimum 5 to 10 rounds. That's also very good impact. So these are the very simple practices we can do our daily activities.
And Dr. Binod, can you please comment on positive psychology, resilience, or positive thinking in regards to stress conditions?
Okay, so positive psychology is one of the very important part. If we what we think is what we behave, right? So our belief system, our thinking system really impacts us. So if we feel loveliness, if you feel kindness, then we can enhance the immune system by enhancing the level of natural killer cell with the help of high amount of endorphin, oxytocin, so that we'll be in the stage of homeostasis. So positive psychology is one of the very important parts. So lots of positive emotions like happiness, silence, such type of feelings can usually decrease the overactivation of our emotional center. So we can use some of the important uh, positive psychology parts, like we can incorporate bhajans or some of the spiritual textbook also we can read. So this type of practice usually decrease the stress by less activating the sympathetic nervous system and promoting the more parasympathetic nervous system, so that we can have a very good amount of health.
Thank you, Dr. Binod, for the insightful answer. Now, my next question extends to both Dr. Rishav Koirala and Dr. Binod. Rishav Koirala commented on mindfulness being a solution, an effective solution for stress, but mindfulness can be a grueling course. It can take up to 6 weeks of practice to get a habit, to build a habit onto it. How do you think that mindfulness modality can be integrated into our daily practice in short period of time, or say in an OPD setting?
I think most of the things that has been suggested over here, whether it's exercise or it's breathing techniques or everything, it doesn't act instantaneously like the way a drug works. So we should make a habit, as the earlier speaker mentioned, that we should have a persistence and make a habit of using these techniques, and it will show good results. And it does take time for a person to really master the technique. Obviously, mindfulness is a very deep thing, and it will take years for a person to totally master it. But the good effects to reduce anxiety or stress or improve sleep can be gained within few sessions. So I would suggest to act right now. The link that I've shared in my presentation, that is also a very good guided meditation. Anyone with without any prior knowledge about mindfulness meditation can just go through that link, listen to the audio, and you can follow mindfulness. It's not a rocket science. It's very easy, I must say, to start with, but it will take for some time to really master it. I think that's the point.
Dr. Binod, would you like to comment on that?
Okay, so mindfulness is a very important part. So there are lots of research as we already discussed. So there are very simple practices which can be done in our day-to-day activities. Like one of the important practices is breath awareness. We can sit in the meditative posture or any comfortable position, maybe in Sukhasana, Vajrasana, or maybe in chair also. So we can close the eyes and feel the movements of the breath, like whatever coming inside the nose and going outside through the nostril will be the just observer. So no any forceful respiration, no any imagination, only the awareness of breath. So this is also very important part. This is called anapana in vipassana meditation, which is very much fundamental practice. Apart from that, we can feel the sensation, like we can close our eyes and we can feel the sound whatever coming in our ears, whatever sense of uh, sensation is there in our body, like a pain or some vibration is there in our body, we can feel. And this is also important part. Another important practice is mindfulness walking. So we can walk and we can feel the change. Usually we walk, but we are not aware of the walking. So we can feel the toss of the feet, we can feel the movements of our hands. This is very good practice of mindfulness walking. Another important thing is mindfulness eating also. So we are eating the food, but we are not aware. We can feel the all the movements of feeding, like we can feel the sensation of toss, we can feel the sensation of chewing. All these things are also very, very important. Apart from that, whatever we do, we can be in the present state according to Hindu traditions also. So Asiva, Khaliva, Dhariva yoga is also there. That is the contribution from Hatha yoga also. So whatever we do, we should be in the state of consciousness without any judgment. And there should be always the observer type of feeling. So these are the very simple technique we can use in our day-to-day activities. Minimum practices like breath awareness in 5 minutes can also reduce the stress. There are lots of research also, and we can reduce the hypertension, blood pressure with only 5 minutes of breath awareness practices also. So we don't need to wait for long period of time. Though if we practice long period of time, we can have a neuroplasticity on all these things. All changes will be there. But for instant relaxation response, we can use these techniques 5 to 10 minutes also, and we can get a benefit.
Now, one last question from our attendees. This is for Dr. Suhas and Dr. Rishav. When do you think is a good time to seek the consultation of an expert, Dr. Suhas?
Yeah, see, this is very, very important to understand where exactly you can do the self-care and where exactly you need to contact the health professionals or the mental health professionals or any physicians. See, if you by adopting some simple basic techniques or the basic self-care techniques, if you're able to manage and if you're able to manage the stress to the level that you are coping ability in terms of your personal life, your social life, your occupational life, you are able to manage yourself, and you are not feeling that distress or that sense of mental disorders like depression, you have suicidal thoughts, a lot of anxiousness, OCD symptoms, drug addictions, and with a lot of withdrawal symptoms. So probably whenever it is severe enough that you are not able to manage by yourself, probably that's the time that you need to contact the health professionals. Thank you.
Dr. Rishabh.
And adding up to Dr. Shetty's remarks, um, everyone should understand that a bit of stress, a bit of anxiety, a bit of symptoms that we've mentioned earlier is quite common, because of these are bad times, and obviously it is all normal for us to get distressed. But what, as he has said, there should be a demarcation. The first step could be trying to manage all the symptoms by yourself, trying to maintain the daily routine, trying to maintain your sleep awake cycle, and do other activities, trying to get engaged in other like daily chores or your work. And you see whether you can comply to that or not. You see whether you are able to exercise or meditation. I think it will come later. If you are able to exercise or not, if you are able to make your routine, daily routine or not, if you are able to cut down your alcohol abuse, if that's there or not. So with all this, if they are still you are not able to change your life, then that is a point. That's the point when you should seek medical help. It doesn't mean that meeting a psychiatrist or other health professional means that you'll be prescribed medicine. That's a very wrong idea. We explore things, we guide, we encourage. There are several other modalities, so we should go for it. Another thing is that we should think about some red flag signs, such as suicidal thoughts, thought about harming, no activity at all, severe lethargy, disturbed sleep for at least few days. Then these are red flag signs. If this continues, then things will get worse, and we should not also wait, because sometimes things get really bad if we wait too long. One thing that a person usually does is, like my patients, I see them, a lot of them, they say that, okay, I kept on trying, I kept on trying, thinking it would be better, but that never came, and they took months, that led to months of suffering. So when you feel that you are not being able to manage these points, then you just go to a health professional, and they'll advise you to keep on continuing or taking short help or long help. There are a lot of options, so that's the thing.
Okay, thank you, Dr. Rishabh, Dr. Suhas. And now I'd like to hand over the session to Dr. Prerak, who will be who will be posing some questions in regards to the integrative aspect of Ayurveda, yoga, and allopathic medicine.
Yeah, okay. Thank you, Dr. Samme. So there is one very much good question from the audience. So how can we make a good approach, integration approach on the most prone portion of this in the pandemic, that is the elderly and or old age person? So I would like to request all the three presenters, what can we make a good approach on beneficially, especially for the old age people?
Yeah, the most important thing is to help them to talk to people, because talking and sharing can be very helpful. And it's all about the ability to be available, the support system, because now we have a lot of networking, which we have social networking, but it's important that we have the family networking, so that each one of us can take the responsibility of our elders, and they should be made felt that they are equally important part of the family. So that sense of the positive things need to be given to them, and taking care about their lifestyle, especially in terms of their food habits, because in the old age, the digestion power and their ability to digest the heavy things is difficult. So eat those which is easily digestible, like a green gram or buttermilk, milk, and plenty of vegetables, fruits which is cooked, because raw vegetables are a little bit difficult to digest, especially for the elderlies. Encourage them to take sufficient which is cooked, easy to digest, and most importantly is to make them do a bit of regular exercises and be available to get connected, stay connected, and make them feel that they're also important or integral part of the family. Thank you.
Rishabh, Dr. Rishabh, please.
Most of the points has been addressed by Dr. Sethi, and I would like to repeat the same thing. I must say, because even WHO has recommended few, like they have given some points. One is communication. It's very important for them, for the elderly, and right now we have a lot of access to communication, so we should make a habit to talking with them for at least some part of the day, through either, if they are present in person, then we should talk in person, otherwise video calls or other modalities would be also be good. the second thing is daily routine. It's very important for everyone of all age. Daily routine should be maintained, because at this time they are not able to go for walks or do so many things that they used to do, like in their free time. So at least waking up at time, exercising some part of the day, if they are able to do that, that's also really good. And the third thing is about awareness. Most of the elderlies, they are already aware about the impact coronavirus COVID-19 can cause on them, and they most of them also know that mortality is high on them. So we should keep on communicating with them, tell them that it's not applicable to each and every elderly person, and tell them if they are away from us, then give them some numbers, like which through which they can easily access healthcare or services, police or other services, if they are alone or they are separate from us. That's also important. Yeah, that's it.
Dr. Binod, do you have any point to add on this aspect?
Actually, lots of things are already explained. So apart from that, we can use some of the simple exercises like Susma Bhayamas. These are only loosening up joints. This can be done easily by older people. And apart from that, some guided imagery technique can be used. So this can be done even they are staying in the home. And breathing exercises are also very applicable in these populations. So there will be less amount of stress, there will be more enjoyment, more happiness, and enhancement in the immune system. So we can ask them to do this type of practices, though they are not able to go outside the home. These are the very good time. So there is a common saying that if you are not able to go outside, you can go inside by doing the yoga practices. So this will be the very important and crucial time for them. So we can ask them to practice such a simple practices.
Okay, thank you, Dr. Binod. So next discussion question I would like to make is, so is there any probability that a person can get all the spectrum of facilities, this we are talking about Ayurveda, Yoga and modern medicine, under the same roof? So what could be the approach for that?
Yeah, I think the situation or the time has come when even the government and the health policies are seriously thinking for the integrative, collaborative, and the interdisciplinary facilities being available to the common man. So even in most of the national institutes, All India Institute of Ayurveda and AIMS, etc. Now they have a separate section of Ayurveda as well as yoga being present there. The whole purpose is to provide all these facilities under one roof. I think see, at the same time, it's also important that we also take this as a research also, because until unless we come out with the evidences of that this works together, because always 1 + 1 may not be 2. When we integrate in some condition, it may not be as effective as we think on a theoretical basis. So equal sufficient evidences should be generated, that people could have the belief about the evidences that we collect. And if the major national institutes and the bigger hospital now have the facilities of this, having all the streams under one stream, I think this is a welcome note. And things to come in the future, that we'll have all these facilities in all the almost all the community hospital and district hospital in the future. Thank you.
Points. I think as a doctor, everyone wishes good for their patient, and they will try to take all the methodologies that is relevant or that does good to the patient. So whatever knowledge that a doctor has, with all the knowledge that a person has. So right now, in terms of psychiatry and mental health in allopathy, we are trying to implement whatever is possible, if that is research based and if that has good evidence. Yoga has already been a part of psychiatry. Mindfulness meditation has already been a major part of psychiatry, and we're still exploring other things. As Dr. Shetty said, we are also looking forward to do more research on use of medicine, also like use of herbs and other things in those patients that I see in my clinic. So we are planning for that. And apart from that, yes, some government level work has already been done, but people looking at the interest of people. So we are trying to create new institutions, new places where you can get both the services, like in an integrated way, like a place where we talk about mental health, we talk about illnesses, and we also use all the possible modalities to help the patient. So it's on progress. I think in future we'll come across more, and there will. It has already, in one sense, it has already been integrative in a small sense, but we're looking forward for more. Thank you.
Dr. Binod, you could have any point out to just roll out?
Okay, so at this time, we need to help our participants and public. So most of the time we need is preventive approaches. So I think yoga and Ayurveda has lots of preventive practices. So this should be incorporated as a part of Dincharya and Ritucharya and their daily activities. So in most of the cases, we'll have a preventive aspect. So in some cases, we can have a Ayurveda and yoga approach along with the modern medicine. For mild and moderate type of conditions, we can use this type of thing as a primary thing. But in case of severe conditions, we have to refer to the modern medical system. So there should be very much integrated approach. First, we have to have such a integrated assessment way, so that we can have an assessment and we can use all these techniques according to the conditions of the patient as a part of personalized medicine.
Okay, thank you.
With the permission of the organization, just I'll add one more sentence.
Sure, sir. Yes, sir, sure, sir. Please proceed, sir.
Yeah, as mentioned by most of the speakers, I think one very important thing that we should always focus is about the training and sensitization of the health professionals in other streams. Like it's equally important that we also get trained and get sensitized, because until unless we know about the other streams, so we'll not be able to implement that. So a bit of sensitization, bit of training of all the health professionals in the allied streams is, I think, what is very, very important to present, so that it comes into practice. Because until unless we are aware about this this integration, we will not be able to take it to the practical levels. Thank you.
Thank you, sir, for your kind remark. And then I would like to share what is the result of our polling, so we can view that it is visible here. Okay, so according to our attendee, so they try to make a, we have got a good percentage also. So in the conclusive session, I would like to request all the three participants. So what could be your, it may be a hard line question, so but please make an outline. Please outline any three points that from which approach we have to go for integration. Only just three outline, please.
I think I had in my short presentation, I had just emphasized that we need to go with the integration of the systems and also understand the areas of integration. Like we can have a horizontal and a vertical planes of integration. So in terms of the vertical integration, it's the system. In case of the horizontal integration, it's about the areas. So in the area of screening, in the area of evaluation and assessment, in the areas of intervention, we can always integrate. But we always should understand that it should not be that we try to do too much of things to the patients and the patient gets confused and they end up in more problem than doing good. So it's important that we understand our limitations and also understand which are those areas where we are understand our potentials also. So at the initial stage, it's better that we try to adapt those areas which is already established. It is established. We have generated sufficient evidences, and people can definitely do it as a natural, and that which are with less side effects or with minimal. They're very safe for the practice. I think those simple techniques can be adopted initially. And as we generate the evidence, I think the further informations and the therapies can be added. Thank you.
Dr. Binod, just please lay out only 2-3 aspects from your yoga.
So yoga can be very much effective part for stress management. Number of studies already showed yoga has an impact on stress reduction, so that we can have a training program with other health professionals also, so that they can apply these type of practices in their common practices also. And along with that, we can have a lots of programs, very small program like webinars or some of the activities with the telepathy, so that we can deliver some of the practices in most of the public homes, so that they can apply these activities. So this is the important area. So apart from that, other techniques, we can use yoga as a part of psychotherapy, as a part of rehabilitation, so they can have a prevention as well as management of stress conditions.
Thank you very much, Dr. Rishav.
Yeah, to tell you the truth, I'm still exploring for the approaches, because I'd like to work on that, because if that's successful, it will be quite revolutionary. But for the time being, in my knowledge, in allopathic knowledge, what you see is a lot of work can be done, especially in the mild and moderate symptoms. Severe symptoms, yeah, side hair, like auxiliary things such as therapy, yoga, everything helps. But once a person is fully psychotic, we haven't been able to solve the problem without using antipsychotics, because there's no other option. If a person is highly suicidal, then we can't take chances saying that, okay, we'll try to use new modalities and see if 6 out of 10 recover, because we can't take chances even in one. So that's a different thing. So in the earlier phase, and in first of all, in the preventive phase, I think preventive phase, Ayurveda, yoga, it has a lot of role, because it has in different terms. Even we talk in terms of biopsychosocial model. And I'm listening to the presentation earlier. I thought that a lot of things were discussed in the same model over there too, like in Ayurveda too. So that can be practiced, like psychological model, like strengthening our own psyche, our positive thinking, using meditation, using yoga to improve that, and social model using food behavior, daily habits to change to improve our mental health. That can be done, and obviously use of these kind of modalities will help a person if they are having mild level of anxiety, depression, or other symptoms. So I think those areas are the most to be worked on, and we can further explore about medicine, because I think I really look forward to do RCTs using Ayurvedic medicine on the patients who come to me. It would be really interesting to see if we can show any change, we can build up any evidence, or repeat the earlier evidence to strengthen it. So I think these are the points. Thank you.
Thank you all the presenters and speakers. So I would like to go for the conclusion of the session. So I would like to request Dr. Samem Maria, and I would like to thank you, the Integrative Medicine Development Foundation team, for the chance and opportunity. Thank you.
Thank you, Dr. Prerak. Coming to the end of this seminar, I would like to thank the speakers, guests, and viewers. Your feedback will be important for the program and provides us encouragement to conduct many such programs in the near future. Stay safe, take care, and thank you.
Thank you.
Thank you, everyone.
Thank you very much.